we, we get a few of those mixed up, but again, thank you for your patience. We had a little seismic event here in California, and it prompted the alarms for a tsunami warning, which was unexpected. And so we had to take action, and I wasn't confident about the internet service I was going to have. But anyway, glad you're all here. And let's move on. Let's get started. Clean hands. Clean hands count. So go ahead. So for the accreditation statement, we have to identify, state that in support of improving patient care, this activity has been planned and implemented by Arizona State University and NIHB, National Indian Health Board. Arizona State University is jointly accredited by the Accreditation Council for Continuing Medical Education and the Accreditation Council for Pharmacy Education and the American Nurses Credentialing Center to provide continuing education for the healthcare team, which is awesome. And so you will be getting for AMA credits, one, you could see the slide. And so the disclaimer is that the Project First Line is a national collaborative led by the U.S. Centers for Disease Control and Prevention, or the CDC, to provide infection control training and education to frontline healthcare workers and public health personnel. National Indian Health Board has partnered with Project First Line as supported through a cooperative agreement, CDC RFA CK 202203. 2003. CDC is an agency within the Department of Health and Human Services, or HHS, and the contents of this webinar do not represent the policies of CDC or HHS and should not be considered an endorsement by the federal government. However, most of the references that are in here can be identified throughout the presentation and are available for you. So first of all, here's a poll question that I want to check everybody. Where is everybody from, or what is their role in their organization? I'm going to go ahead and put it in the chat. We have infection preventionists here, I'm guessing, healthcare professionals, nurses, technicians or aides, medical assistants, nursing assistants, administrators, environmental services. Good. Thank you for doing my poll for me. And we have a couple of public health. I'm not sure if it's not working. Oh, here we go. Nice.
Are you seeing the responses?
Yeah, I've seen
Okay.
infection preventionists, public health professionals, and technicians and administrators. So this is great. Okay, let's see. For the sake of time, I think that we probably have our
So you
numbers here.
37%. So 37% of public health professionals,
Mhm.
25% are infection control, are doing
Awesome.
infection control work.
Good job, you guys. Everybody's welcome and everybody loves hand hygiene, right? All right. So what type of healthcare facility are you working in? Let's see what's up with that. 63% are outpatient. Oh, okay. Yeah, that's where I'm at. I will introduce myself a little bit more here after we get this poll. Wow, there's a lot from outpatient, some from hospital outpatient, and then other. I want to know about other, if people want to put that in the chat. Oh, health educator, family parenting support specialist. Awesome. Hand hygiene is important everywhere, isn't it? All right. So you guys are all busting through these polls, I can see. All right. So for our objectives today, I do want to describe well, first of all, I'm just going to say a little bit about myself. So I'm an infection preventionist. I work for the United Indian Health Services organization in Northern California. We are supporting a consortium of 9 tribes in Humboldt and Del Norte counties in California, and we are an outpatient services multi-site clinic system. So we offer behavioral health, physical therapy, occupational therapy, pharmacy, of course, dental, behavioral health, vision. And so we have a wide variety of service lines. And but it's all outpatient. So I don't have some of those restrictions and those requirements for a hospital-based organization. And I do come from a hospital based organization or hospital outpatient as well as home health. I've been doing healthcare for a while now. But right now I am working for the United Indian Health Services as the Employee Health Infection Prevention. Oh, sorry about that. I don't know how I got muted. Anyway, I don't know where we were, but anyway, I was describing what I was doing and where I come from. How far did we get, Adriana?
We got you to the last objective.
Oh,
So we on the outline now.
okay. Well, anyway, if anybody wants to know about my background, you can contact me. So anyway, obviously we have a call to action for hand hygiene. I'm going to go over the scope of the problem, a little anatomy, a little history, and then the current recommendations. I'm going to go over all of the items on this outline, but I do want everyone to understand that this presentation is just touching on the hand hygiene programs and standards and HAIs. Each item that I discuss has much more information than what is going to be presented here. And this presentation is a little self-serving because of my unique situation and my clinic setting. I want to get some ideas from some other folks about how they are monitoring their hand hygiene compliance. So just to understand that as we move forward. So next slide, please. So what is hand hygiene? Hand hygiene means cleaning your hands. So we clean our hands either by washing our hands with soap and water, or we use an antiseptic hand wash. Hand hygiene also can include surgical hand antisepsis, but today, for the purposes of this presentation, we are just covering hand washing and antiseptic hand wash or hand rub. All right, next. And I think, was this one of the polls? How many times do you wash your hands or use alcohol-based hand sanitizer throughout an average work day? I think it was in the polls. Let's see how many times. Oh, maybe that wasn't in there.
The next one is a poll. This one was like a free answer.
Oh, free answer. Okay, well, the answer is the 100 times per 12-hour shift has been documented depending on the number of patients and the intensity of care per the CDC and some of their surveys. And you can find this information on our slide deck. We do have references if you want to find this. So 100 times a day, 100 times a day. That's a lot. And so next slide. Or 100 times in a shift. You're going to be doing it more often, obviously. So this illustration is just one example of the information that we've been given over the years about HAIs. What is a healthcare associated infection? What is the rate of infection? How many patients in hospitals have acquire a hospital acquired or a healthcare acquired infection? And so some of these numbers are a little bit mixed, just so you know, just for full disclosure. 1 in 31 hospitalized patients has an HAI is more of a current reflection of our HAI rates in hospitalized patients compared to 2009, which I think it was like 1 in 17 patients. And so we've improved some of those measures. And we've also seen healthcare dollars being talked about, 28.4 billion up to $45 billion annually in direct healthcare costs, and that doesn't even talk about the indirect costs for hospital or healthcare acquired infections. I'll stop saying hospital acquired, it's healthcare acquired. And so there's lots of different factors for this, but um, there are some indications, and you can find this on the CDC website, that overall, catheter-associated urinary tract infections, MRSA bloodstream infections, central line-associated bloodstream infections, ventilator-associated events, and CDI or Clostridioides oides difficile infections are continuing to decline, which is great news, but I don't want to minimize the overall impact that HAIs have on the health and safety of patients and staff, nor do I want to minimize the importance of hand hygiene in healthcare settings. So let's continue. So why is hand hygiene important in healthcare? I would want to say, why is hand hygiene important at all? Why is hand hygiene important? And there are some things that you can see. Of course, this slide reflects community data. So in an average workplace, a non-healthcare associated workplace, statistics have shown that it helps prevent staff from getting sick and spreading germs, results in employees using fewer sick days, lowers the chances of getting sick with respiratory illnesses, and cuts down on the number of people who get diarrhea. And for those with weaker immune systems, reduces diarrhea illnesses. So all of that is very, very important. So can you imagine what the impact is actually for healthcare regarding, with in healthcare settings? How important is hand hygiene in healthcare settings? So obviously it's going to be pretty important. I think it's something that we all agree on, that hand hygiene is one of the, well, we'll get into how direct results for hand hygiene can impact our rates of healthcare associated infections. So anyway, so I wanted to just sit on this slide for just a minute because I want you to all think about what is missing. Where is the data on hand hygiene? How do we sit with our data on hand hygiene? How compliant are we? I've seen multiple results based on different surveillance that people have done, different organizations, different companies, different public observations, and I think that we can all identify or have all heard that hand hygiene compliance is terrible. It's really terrible worldwide, but I've seen some numbers as low as 40%, less than half of the time are we washing our hands as we should be washing our hands. So why are we having such a hard time with this data? Why are we having such a hard time identifying what our true numbers for hand hygiene compliance are? Does anybody have any guesses? You can just throw it into the chat. Why would it be hard for us to measure hand hygiene? What's so hard about that? Okay. I am not seeing the answers. I'm not sure why. The results could be skewed because you aren't seeing anyone actually doing it in the restroom. That's good. Yes, right. Difficult to monitor. Absolutely 100%. And so I think that some of the things that we have discovered, all of us, while we've attempted to do this, is that there's the Hawthorne effect, right? So if somebody sees you with a little clipboard and you're like watching them, what are you going to do? You're going to hit the hand hygiene and you're going to be like, I'm washing my hands. See, I'm washing my hands. Difficult to test, subjectivity and observer bias, resource limitations. How hard is it to go out to 9 different clinics and watch people cleaning their hands? It's pretty hard. There's underreporting from the automated systems that are available, unclear definitions of compliance. What is compliance? And we're going to talk about that. Reluctance to report noncompliance. Like, I don't want to tell you how bad we are. I don't want to tell you that our numbers are really low. Complex workflows and high demands. Of course, we're all busy and we all have different workflows, and then variation on compliance by role and task. So we can see different numbers coming through if it's maybe a medical assistant versus a provider, or maybe a physical therapist versus the physical therapy aide, or maybe the dentist versus the dental assistant. And the public doesn't take it seriously to wash their hands. That's true. All right, let's move forward to the next poll. Healthcare workers' hands can serve as primary vectors for the spread of germs and infections within a healthcare setting. Of course, this is what's true, right? How many people are going to say it's true? Of course, everybody's going to say it's true, right? So, healthcare worker hands are considered a primary vector for the spread of germs and infections within healthcare settings. Obviously, we know this. Meaning that they can easily transfer germs from one patient to another due to frequent contact with patients, and also from medical equipment to patients. And so proper hand hygiene, I think, cannot be argued, is important to spread disease. We all know that. All right. Transient microbes. This looks kind of like a fun but busy little slide. Transient versus resident bacteria. And so what this is illustrating is just basically it's really, really important in any healthcare or any hand hygiene recommendations or studies that you look at will note that it's really important to understand the anatomy of the skin, especially the skin on the hands. And so there's the good, bad, and the ugly germs and where they live on your skin. So our resident flora or the resident microbes that we have can be found deeper in the depths of our skin and are not usually related to infections or transmission of infections. It's the transient microbes that live more on the surface layers of our skin. And so they can be, your skin, because of the layers of your skin on top are kind of flaky and irregular, they can easily pick up microbes. And so one of the things that we find is that you can easily wash off these microbes, but they're really super easy to pick up. And so what we want to do is encourage hand hygiene all of the time. And so basically, transient bacteria versus resident bacteria, you're not going to worry about you can worry in some sterile procedures. You will worry about doing a surgical scrub so you can make sure that you're getting into the deeper layers of your skin while you're cleaning. But for our non-sterile procedures and care of our patients, we are basically, I'm on the call procedures. Okay. Yes, procedures. So we will worry about the resident bacteria for procedures, but transient flora is something that we need to discuss for the basic information for hand hygiene. All right, let's move forward. So a little bit of history, just so you know, obviously this timeline isn't to scale. If it was, it would look a lot different than this. But many of you know the story of Ignaz Semmelweis and, of course, our Queen Florence Nightingale. But Dr. Semmelweis found that there was a higher mortality rate in maternity ward, one clinic compared to another, and identified that one of the reasons, probably the reason, was that the doctors who were working in one ward were actually coming from performing autopsies and then taking care of women having their babies. And that led to a high rate of infant and maternal mortality. And so, and the midwives that were taking care of the other clinic, their mortality rates were nowhere near this terrible rate. So he he implemented some policies about disinfecting hands, but his idea didn't really take off right away. And he was kind of like, you're a weirdo, and we're not going to really pay attention to you because you don't know what you're talking about. Of course, we had Florence Nightingale, who was all about promoting a clean environment and hand hygiene. Finally, in the 1870s, surgeons began to wash their hands, and there was something to that. Thank you very much for washing your hands. And then in the 1980s, the CDC came through and integrated the hand hygiene as a standard preventative practice into their recommendations. And then when we move forward into the 2000s, there were some pandemics that kind of increased the awareness and the importance of hand hygiene and all things infection control. Obviously, we saw through COVID in the 2020 time, 2021, 2022, hand hygiene was pretty high up there. And there are some anecdotal reports and observations, haven't been verified, suggesting that some of the bathroom lines became a little bit longer. The men's bathroom lines became a little bit longer because maybe they were washing their hands a little bit more. And so it was one of those things that there was like this just anecdotal reports from more than one source. And anyway, so in 2022, we received some updated guidelines from SHEA, IDSA, and APIC, and they are supplementing the HICPAC guidelines, which we'll talk about on the next page. So the Healthcare Infection Control Practices Advisory Committee, or HICPAC, developed some guidelines in October of 2002, and those are, well, there's all kinds of guidelines from this organization. It's a federal advisory committee appointed to provide advice and evidence-based guidance to DHHS and to the CDC regarding the practice of infection control, including strategies for surveillance, prevention, and control of healthcare-associated infections, and also antimicrobial resistance and adverse events. So I highly recommend to anyone, and I don't know if you'll be able to see my copy, probably not. It is the MMWR. You won't be able to see it, but anyway, it is the guideline for hand hygiene in healthcare settings from 2002. I highly recommend that everyone grab a copy and become more familiar with that guideline because it's very comprehensive and it addresses a lot of things. And so anyway, it comes highly recommended. So 2022, we received some updates to those recommendations. And I would recommend, if you're not familiar with those recommendations, that you download a copy of them as well. All right, so next page, please. So the summary of recommendations that came out of this 2022 document was, number one, to promote the maintenance of healthy hand, skin, and fingernails. Hand, skin, and fingernails became a bigger issue. Selection of appropriate products to make sure that we had them. And then ensure accessibility of hand hygiene supplies. Of course, we want to have hand hygiene supplies. We want the appropriate ones. We also want them to be available. Ensuring the appropriate glove use to reduce hand and environmental contamination. We're going to discuss that a little bit. Taking steps to reduce environmental contamination associated with sinks and sink drains, and monitoring adherence to hand hygiene, and then providing timely and meaningful feedback to enhance a culture of safety. And I think that we can all agree that that's going to be very, very important. And there are some, we'll discuss a little bit about the timely and meaningful feedback. But I do want to say that I'm not covering number 5 today. But number 5 is something that you can read more in depth, and it's to take steps to reduce environmental contamination associated with sinks and sink drains. And this has to do with trying to make sure that you have a designated sink for hand hygiene and you're not having it be a multi-use sink. For example, dirty instruments are being soaked in the sink and I need to clean my hands because that's the only sink. Or avoiding the disposal of tube feedings or IV solutions, etc., down the sink drain, and making sure that it's part of a regular routine environmental cleaning, disinfection, and part of your environmental surveillance to make sure that you don't have any terrible bacteria growing in there, because some of those solutions that I mentioned, the tube feedings and the IV solutions, can promote the growth of biofilms. And so we need to Sorry about that. We need to make sure that those sinks, we need to discourage that practice. So moving forward, here's another poll question. Which hand hygiene method is best at killing bacteria? And I know everybody has seen this one, right? You've all seen it, and you've all seen some different opinions about it, I bet, because there's like the lay opinion and then there's the healthcare worker opinion. So we all know it's alcohol-based hand rub. And I think that you can catch the resource if you are looking for that, but the bacteria is reduced when you have alcohol versus the soap and water, but not to dismiss soap and water because we do need to talk about that. And okay, alcohol-based hand rub is the answer. Okay, next slide, please. Know when to clean your hands. So I call these the 3 B's and the 3 A's. So immediately before touching a patient, because we're all familiar with what the 5 moments of hand hygiene, right? But these are the 3 B's and the 3 A's. So immediately before touching a patient, before performing an aseptic task, such as placing an indwelling device or handling an invasive medical device, before moving from work on a soiled body site to a clean body site on the same patient. And we've all been there. We've all been taking care of a wound or emptying a Foley and then moving to do a central line dressing change, or I try to do clean tasks to dirty tasks, but sometimes you can't help it. But those are all the befores, those are all the B's. And then after touching a patient or the patient's surroundings, after contact with blood or body fluids or contaminated surfaces, and immediately after glove removal, because why? Gloves are not a substitute for hand hygiene. And we'll talk a little bit about gloves in just a minute. All right, let's continue. When to use alcohol-based hand sanitizer or alcohol-based hand rub. So alcohol-based hand sanitizer. So let's go. Alcohol-based hand sanitizer, alcohol-based hand rub. When would you be using this? It's the preferred method unless the hands are visibly soiled, and they're usually less irritating than soap and water. And we want to make sure, as a side note, that there's at least 60% alcohol in the product itself. And of course, we're going to use soap and water when our hands are visibly soiled, right? We all know this. When they're visibly soiled, after doing what? Before doing what? And during the care of patients with suspected, we need to go back, with suspected or confirmed infection during outbreaks of C. difficile and norovirus. So I know that a lot of people have, and we could talk a little bit more about that, but C. difficile is a spore-forming bacterium that lead to a common healthcare associated infection and severe diarrhea, right? And the bacteria can be transferred from patients via the hands of healthcare workers who have touched a contaminated surface or item. So unless the hands are visibly soiled, alcohol-based hand sanitizers is still preferred over soap and water for cleaning hands in most clinical situations. And this does not change if it's just a patient with C. diff. It changes when it becomes an outbreak, because studies have shown that there is not a clear prevention benefit for soap and water versus alcohol-based hand sanitizer in a healthcare environment unless there is an outbreak. And when you are looking at care of the C. diff patient, we want to make sure that we are being compliant with all of our contact precautions. And so that has been seen to be the biggest impact in preventing C. diff spread, is making sure that we are applying proper PPE for contact precautions and removing PPE properly so we're not contaminating ourselves or the environment. So to wash our hands with soap and water, and back on the alcohol-based hand rub, I didn't really discuss it in depth, but with ABHR or alcohol-based hand sanitizer, we want to make sure that we are rubbing our surfaces and we're making all of the motions. And I think it's important that we are familiar with all of the motions of proper hand hygiene, all getting the thumbs, getting in between the fingers, and getting the finger nails and doing all of those things. But you're going to want to apply enough product and then rub your hands together using those motions until the product is dry. It might take 15 to 20 seconds, depending on the product and the volume of the product that you apply to your hands. So when you ask somebody a little trick question of how long should you rub your hands with hand sanitizer, the answer is until it dries. So back to soap and water, please. Wet hands with soap and water and apply the product per the manufacturer's recommendations. Of course, we're going to use manufacturer's recommendations for all of our tasks. We're going to rub all surfaces together vigorously for at least 20 seconds. And on the CDC website, you will find 15 seconds versus 20 seconds. We're going to say 20 seconds because 20 seconds is a little bit better than 15, isn't it? And so 20 seconds is the recommendation by the CDC, but you will find 15 in some other spots. Rinse hands with water using disposable towels to dry, and use a towel to turn off the faucet. And again, going through all of the motions to ensure that we are doing a good job with our scrub, with our hand hygiene product. We are getting the backs in between our fingers, our thumbs, and our fingertips. And I think, there you go. Dry your hands with a disposable towel, and then don't forget to use the towel to turn the faucet off. Next page. Thank you for your patience. Hand, skin, and fingernails was a big issue in the new recommendations. And I think that it's really important that we clarify with staff, because staff will say, oh, I can't use that alcohol-based hand sanitizer because it irritates my skin. And while that may be true, it's usually not the case. The case is usually that it's more irritating for hot water and excess soap, or it might be a soap product, but the water and the soap and multiple hand washes with soap and water can remove those protective layers from our skin and then cause this irritation, which of course leads to increased bacterial transfer and bacterial growth. So we're going to avoid using hot water. No personal lotions or creams. I don't know how many people see the stuff from Bed Bath & Beyond hanging out on the sink. People like to use their flavored lotions or whatnots. Artificial nails in clinical areas, of course not. We can't have those. But one of the things that I found in the new recommendations, thankfully, which was nice, I'm used to hearing about the 1/4 inch has always been the standard guideline for policies and procedures. 1/4 inch nails, no longer than 1/4 inch. If you're going to have natural nails, no longer than 1/4 inch. Now, natural nails not past the fingertip. So if somebody's holding up their hand, you should not be able to see the nails past their fingertip. So that's quite a change. I'm impressed with the change. I haven't seen any official guidance, and of course, everybody can make their own policies regarding this practice, but I think it's really, really important given where the bacteria is usually found. And I think it's really important that we pay attention to our fingernails and our skin. And personnel with hand irritation should use cotton glove liners. This is also part of the recommendation. And by the way, this is recommendation number 1 listed on our summary of recommendations. All right, let's move forward. So glove donning and doffing, this is recommendation number 4. And so a 2019 study found that 37% of healthcare providers inadvertently contaminated their hands during glove removal. I can see that because there's different ways to remove your gloves. So you want to perform hand hygiene before donning your gloves and promptly after donning gloves. And I know that that's always a challenge for people to do, especially performing hand hygiene before they don their gloves, because they might be doing it in a hurry and they can't wait for the hand sanitizer to dry. And I'm going to address Martin. There's a note in the chat about is that a recent change for C. diff and using alcohol-based hand sanitizer? And no, it's not a recent change. It's actually just more becoming more to the forefront. And I can't tell you how many times I have found the hand sanitizer dispensers being covered with a piece of paper saying soap and water only for those patients who had suspected C. diff. It's not new. Um, and in fact, it's several years old. And I had to do a little digging to actually find it and find consistent recommendations. But the studies that they did to figure this out um, about the hand alcohol-based hand rub or hand sanitizer is preferred in healthcare. Of course, it's more available. It's easier on the hands than soap and water. We're washing our hands or cleaning our hands over 100 times a shift. It is something that is not new. It's just, I think that we just have some new information that we need to share with people. And so I really want to encourage people to look at some of this data and some of the recommendations that are out there. But back to gloves. So removing gloves is really, really the proper way to remove gloves is also available in the CDC, but there is a standard way to remove gloves so you are not contaminating your fingertips or your wrists, which are the most often contaminated areas. So I would recommend that you do that. There's a lot of studies that had to do with how people, I think there's some study that's called Contamination of Healthcare Personnel during Removal of Contaminated Gloves. And it is a 2018 reference. And if you would like to read the study, I will send that information to Dree so she can post it to everyone. So, okay, let's move on. Be careful with your glove removal. More recommendations. So we're going to highlight here, do not. We're going to make sure that that do not is before every one of these bullet points, okay? Do not supply individual pocket-sized alcohol-based hand rub in lieu of wall-mounted sanitizer dispensers. Do not refill or top off soap, lotion, or alcohol-based hand rub. Do not use antimicrobial soap with triclosan. That was taken away from us in, I think, 2016, 17, 18, somewhere around there. Anyway, I'm not going to get into antimicrobial soaps with everybody right now, but it is a discussion that I love to have because I'm a nerd. So do not routinely double glove during care, except when there's some specific recommendations in response to high consequence pathogens. Ebola, for example, I think that we can all agree that that was something that everybody was recommending, the double gloving, right? Routinely, and do not routinely disinfect gloves except when specifically recommended, again, for these specific high consequence pathogens. And do not remove access to alcohol-based hand rub when responding to organisms such as C. diff. So again, that is something that I remember all of the time walking through the hallways and getting into rooms and having those alcohol-based hand sanitizers covered with paper and soap and water written all over them, removing the alcohol-based hand sanitizer because they suspected C. diff with the patient. Do not attempt to remediate potential biofilms in sink drains with disinfectants lacking EPA registration for this use. And I think that, we briefly touched on that recommendation about the sinks. And so it is something that you can find in these more in depth in the recommendations that came out. Go ahead. Next page. Okay, so here's the $1 million question. What do you think your compliance rating is in your facility? I just want to take a couple of moments to see what people think. How is your compliance rate? 35. Okay. There's no judgment here. I can tell you that. And I would be I'm impressed with anything over, and I want to find out more about how you check your compliance. I love this. 40, 50, they need work. 45, absolutely. And if you have Randy says we have good compliance. Okay. I'm not sure. That's according to our patients surveys. Oh, they're really good. Okay. All right. Well, I'm impressed that you all have your numbers. That's really great. And I think that we all need to work on some strategies to do that and infection control audits. What is compliance? I think that that was my main question. We're going to discuss this in a bit. So we're going to focus on on patient and healthcare worker safety and compliance. And that's what our audits are about, right? And we want to make sure that we're doing the right thing. My high score is due to a single surveyor and Hawthorne effect, I'm sure. Thank you, Martin. That's funny. And so that back with the audit process, identifying areas for improvement, and we have lots of tools that are available to us from the CDC. In California, we have California Department of Public Health has some observation tools. Those quick observation tools or QUATs are available for specific procedures if you wanted to just audit specific procedures and hand hygiene practice. And for example, like if you were going to do a central line insertion and you decided to do some audits of central line insertion, and as part of the bundle, you are actually doing auditing their hand hygiene practices. And some tools are used by accrediting organizations, the ones that you will find. So organizations choose to use them because they're like, well, if I can check off yes to all of these questions by the surveyor, then I must be good. So, but each facility has its own unique features that may be challenging to get accurate information and to use those tools. So you might need to develop your own tools. So, all right, let's move forward. Common barriers to hand hygiene compliance. So skin dryness and irritation, I think we talked a little bit about that. Time. I don't have enough time. Lack of access to supplies. Why is there a lack of access to supplies? Because the sink is all the way down at the end of the hallway and the hand sanitizer dispenser is empty in the room that I'm in. Lack of knowledge and awareness. Emergencies, of course. You can't really beat the emergency reason because, people want to be in a hurry, grab the gloves, put them on, and take care of somebody to save their life. I understand that. What are some barriers to your team? And how can we address those barriers, do you think? I mean, I think providing the appropriate products, increasing staff awareness. What else? What are some other ideas that people have to break some of these barriers or to combat them, get over them? All right. Well, I'm going to throw out a couple. Adding signage to increase awareness does it for not only the staff person, but also the client or the patient. And the signage that says, ask me if I cleaned my hands. I think that that's a nice invitation. We want to make sure supplies are visible and not hiding behind curtains. I don't know how many times I have been in a room and the hand hygiene is actually behind a curtain. So I think that it's important that we pay attention to the location of those hand hygiene dispensers. And how about inviting the clinical team and the infection prevention team to design meetings for any new construction and renovation? Maybe we have some good ideas about where to put some of these hand sanitizers. All right, next slide, please. So this is just a summary. These are some hand hygiene adherence monitoring methods: direct observation, automated adherence monitoring through the devices, or maybe a badge. You walk in a room, and if the hand sanitizer has been hit, then it will say, "Oh, Michelle walked into the room and she hit the hand sanitizer." Product volume event count measurement, a measurement of the product, how much product you're going through in a week. I'm not sure I could do that because that in and of itself to me would be a big challenge. And then staff surveys and patient reports. And I'm going to say that that's kind of where we are leaning because we do have an outpatient setting and our rooms are a little small. We're not going to be able to be standing in there and watching observations through all of the elements of their compliance. Are they doing it? All of the three B's and the three A's. Are they compliant with hand hygiene, or are they just compliant with entry and exit from the room? All right, next. So the recommendation is to use multiple methods, use the automated method, use patient feedback, use overt and covert, so the secret shopper. But once that secret shopper is identified, then of course it's not secret anymore, right? And so the recommendations are that you limit that observation period for about 15 minutes. And then the product volume measurement, consider advantages and limitations to each, and then establish a process and develop training because your observers have to be trained on how to do this. So then you're minimizing some of that bias or that misunderstanding about what it is that's happening. And this is recommendation number 6 on the line list of recommendations that I gave you. All right, next slide, please. So here are some examples of some audit tools that are available to you widely available through the CDC, especially, but also through some other organizations, some accrediting organizations, and I'll touch a little bit about some of those. And so next slide. So again, what to monitor? What are we monitoring? Are we monitoring just entry and exit from the room? Or are we monitoring the whole 9 yards? Monitoring the whole 9 yards, all the three A's and the three B's would be difficult, I would think. But the tools, the use of tools in your surveillance activities can help to ensure the compliance for hand hygiene. And a lot of times we use the entering and exiting. I like to recommend, just me, I like to recommend to all of the clinicians that they use it as a script in their care. I want to take your blood pressure, but I'm also going to clean my hands. I'm going to clean my hands first before I take your blood pressure. I'm going to clean my hands before I listen to your lungs. I'm going to clean my hands before I look in your mouth. And so then we're scripting it, and then the client or the patient remembers this. And they say, oh, that's important. It's important to my healthcare worker. It's important. So it must be important to me. And so maybe I should be doing it more. All right, next slide. So the timely and meaningful feedback, I think that this is really important because you don't want to see 6 months later some survey results like, oh, if I found out that my team didn't do proper hand hygiene 6 months ago. Okay, well, that's not really helpful. And so what's the plan? And so we want to make sure that we have and we want to make sure that we have respectful feedback and try to be private in a private place. And there are some tools and recommendations and videos that you can actually use to teach other people on how to provide that feedback. But real-time feedback for safety during procedures is really important. If you're in a surgical procedure or you're in a sterile procedure, if it's something that is completely missed or done unwell, then we want to make sure that we're giving that feedback right away for safety. And this is recommendation number 7. All right, next slide, please. So Clean Hands Count campaign is a campaign that is one of many campaigns that has provided some resources for education and training for staff, clients, and communities. I like Clean Hands Count. They have a lot of good resources. They have great posters that you can download for different settings, posters directed to the community, the clients, the patients, as well as to the healthcare workers and the providers. And I think that that's really important that providers and healthcare workers understand some of these numbers and some of these concerns about hand hygiene compliance. Next. Also, the CDC hand hygiene education and training that's called the 4E's. And I will just give you, this is just one video. We're not watching the video today, but the link for this video is in here. I encourage everybody to look at the entire program, which is the 4E's of engage, educate, execute, and evaluate. And it's widely available and endorsed by several organizations, including the ASC Quality Collaboration for the Ambulatory Surgical Centers and the Patient Safety and Quality Healthcare, or PSQH. And they recommend using the tools that are available in these trainings. And this is all on the CDC. They're pretty short videos, but it does give you a lot of content. So again, this is the closing of my presentation, but National Hand Washing Awareness Week, as opposed to National Hand Hygiene Week or whatever it was, Hand Hygiene Day on October 15th, just one of many campaigns. And then there's also May 5th, which is World, I think, Hand Washing Day. I think that it's really important that we use these opportunities to be able to share our information that we have and share the importance of hand hygiene with our clients as well as our staff. And so again, the studies that are showing that healthcare workers practice hand hygiene less than half of the time that they should. This is terrible. But we tried to present it during Hand Washing Week, and there was a little seismic event and a little tsunami warning that prevented that. But any hand hygiene awareness campaign can work to engage patients as well as clients. And I mean, and as well as staff. And we use a training device, right? We use a training device that provides real-time information or feedback on the observations of the healthcare team in hand hygiene. And I think that that's really important. You get real-time feedback on your technique for your hand hygiene with this device, and then we make it like a contest. We do it for regular staff training, and we make it a contest for different individuals. We have prizes, and I think that that's really important, and to break some of those barriers for compliance, the reasons why we're unable to be compliant with hand hygiene. I think that we need to work on um, multimodal monitoring. I think that that's important, and then regular staff training, and provide culture change to and just normalize that whole discussion with our clients and our providers. Hey, ask me if I cleaned my hands. I think that that's really important. And Martin, I want you to PM me. I'll put my email in here. I want you to PM me because I'm not going to be endorsing any products, but I will provide that if anybody has any questions. My email is right in there. So any questions? Whoops, I guess we endorsed it. We told our story. Free commercial, I guess. Sorry about that. All right. How are we doing? We're doing pretty well for time. I think we have a few minutes for questions.
Yes, ma'am. The floor is open to questions now.
All right. So evaluation tool is there in the scan. I think I'm going to try to scan it just because I like doing scans. And there it is. Qualtrics. Yay. Thank you for providing me this opportunity to speak about hand hygiene. I'm kind of a nerd and passionate about all things infection prevention. I have to say that during my research on this topic was really enlightening to me, and it implemented a lot of practice changes for me as far as surveillance, looking at ideas for surveillance, looking at other audit tools, looking at other statistics, and then realizing that we do have a problem. But I do want to also encourage everyone to look at the updated guidance. And this was led by Dr. Glowicz for the SHEA IDSA and APIC a practice recommendation in 2022, that update. Very, very helpful. And so I can't emphasize that enough. Do your research, find something creative, something that's going to work for you, but it is so, so very important.
Michelle, I have a question.
Hi, Tyrone.
Hi. Um, so my question is, what are some strategies that you give to healthcare personnel who don't wash their hands? And maybe can you talk about, you know, if you kind of warn them once, what happens after that?
Mm. Yeah, so those courageous conversations and direct feedback, I think that that's really, really important. I think that we want to seek information. We want to find out what is keeping you from being able to clean your hands regularly. Like what is it that's keeping you from being able to do a good job with hand hygiene? And this is so important. And I think that also emphasizing in that courageous conversation that your hand hygiene component and compliance is going to be integrated or is integrated into your job description. That's part of your performance improvement. And if you can get real-time feedback, there's some opportunity there to also give them annual feedback on their performance review, because it is really important. If you've addressed all of the reasons, do surveys, survey your staff, and find out what are the reasons why do you not like the product. We did a survey with a test of what product we were going to use here at all of our sites. We had the vendor come out with lots of samples, and we had everyone try it and then fill out feedback forms, and then that's how we chose our product. So making sure that there's a product choice if that's possible. Sometimes it's impossible to turn over an entire product line. However, it's not, like let's try different products. And is it location? Is it signage? Is it availability or access to that product? What is the barrier? Any other questions? And if you have more questions about the C. diff topic, I encourage you to reach out and email me about that if you want more information about it, because I know that people lost their minds during some presentations that said that gave those recommendations that said, no, alcohol-based hand rub is still recommended in healthcare facilities. And it doesn't change in the case of a patient with C. diff. And people were like, what? Well, I mean, you're going to wash your hands when they're visibly soiled. You're going to be using contact precautions. And if you look at the overall availability of product and then all of the studies that they did around that, then it makes sense. But back in my day, that was no. You were going to use soap and water, and that was it. Gloves or no gloves, you're using soap and water. So only in the case of an outbreak. So there's that. All right. Are we wrapping
All
it up?
right. So we're at the top of the hour. Let's use those emojis. They're already doing it because they know what I'm about to say. Let's use those emojis to show Michelle our appreciation for joining us today. As I said, y'all, she's a joy to speak to. I put her contact in there. This is her passion. She works with several facilities. She's a wealth of knowledge. She loves the work that she's been doing, and she's been doing this for over 15 years, y'all. So, like, definitely, she is a resource. She know them CDC regulations. I'm gonna tell y'all that because she got me together quick. So, definitely trust that she's read those guidelines and she's also implementing those things. And Michelle, I just want you to be clear on like the love that you're receiving in the box is well deserved. You do an outstanding job for the staff and for all staff, not just the healthcare ones, but all staff, pushing this information out, having the trainings and doing the audit. So definitely, y'all, use Michelle, email her. She loves to talk. She do not mind, not in a bad way. She a good conversationist, but also she's also one of those people that's gonna follow up with the resource. So she will say something and then follow up on it, and so that's what makes the difference between mentorship and then having this space to just like network. So again, thank you all for attending. The slides, the recording, the resources that Michelle mentioned will all be in the follow-up email. Please continue to do the evaluations. That's how we get our funding to continue these webinars. If there's any topics that you all want to do, please let us know in that evaluation form. But other than that, it is 5:01. I want to be respectful of everyone's time. From the bottom of my heart, I thank you all for the service to Indian country, to your healthcare facilities that you serve, to the American Indian, Alaskan Native populations that you serve, both on and off the reservation, for those that's in urban Indian areas as well. And I wish you all, I hope the Creator bless each and every single one of you this holiday season, because I know everybody could be going through something. So regardless if this is a good season for you, this is a grieving season, please note that NIHB love you and appreciate the work you do, because you show up. And you show up in spaces that are sometimes really hard to show up. And I just want to make sure I make that clear. And I want to thank you all for the work that you have done in 2024. And Dree will see you all in 2025. So Merry Christmas, Happy Holidays, and Happy New Year.
Thanks, everybody.